here are some exercises that you can do to release tension on the lower back and in the spine in general. So find us, lie on the floor. Make sure you have something to support your body here. And then just take a moment here and just feel your spine. Take a deep breath into your nose and slow exhale through your mouth. Let's repeat this breath. Inhale. Slow exhale through the mouth. One more breath here. Inhale. And slow exhale. Good. So the first movement we're going to start here is trying to create a little bit of more flexibility and mobility on the pelvis. The pelvis, the relationship of the pelvis with the legs. So you're going to bring your hands to the sides of your pelvis. And then as you inhale, I want you to think about lifting the pelvis towards the ceiling. So if you place your hand behind on your lower back, you're going to notice the space of your lower back lifting away from the floor. That's on the inhalation. We call this anterior tilt of the pelvis. And then on the exhalation, we're going to do the opposite. We're going to tilt the pelvis back, and now you're not going to feel any space between your lower back and the floor. And we're going to repeat this for a few times. So as you inhale, anterior tilt, notice the space. When you exhale, you press the lower back on the floor as you tilt the pelvis back. And then find the rhythm of your breath. Inhalation, anterior tilt, exhalation. Let's do 5 more times. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Let's do one more. Inhalation, anterior tilt, exhalation. Good. And then find a neutral spine here. Let's move the legs side to side. Go slowly. Inhale as you lift. Exhale, you move both legs to the other side. And keep moving like this. Inhale. Exhale. Inhale. Exhale. And then just make sure you are not feeling pain as you move, okay? So if bring the knees too close to the floor creates any tension or pain, just make sure you just go side to side without increase any symptoms, okay? And then let's stop at the center. We're gonna lift one leg, so you're gonna use your right hand to press the right leg. When you lift, create some tension here between your hand and your leg, and then place on the floor. Lift and press. Notice the resistance, a little bit of the arm and the leg, and then put it back on the floor. 3, 4, let's do one more, and 5. Good, let's do the other side. Lift, create the resistance and hold for a second, and then put it back on the floor. 1, 2, 3, 4, and 5. Good. And then rest. Make sure you release any tension on your upper body. We're going to bring the feet close together. You're going to inhale in this position. When you exhale, you're going to open both legs. And then lift. Inhalation. Exhalation. Inhalation. Exhalation. 2 more. Exhale. Inhale. Exhale, and then stay with your legs open, the soles of your feet close together, like touching one another, and just allow your body to relax here. And then let's bring awareness to the breath. Again, if you want, you can place the hands on your belly. Inhale, just feel the belly rising. Slow exhale. And notice your ability to rest, to relax the legs. Inhale. Exhale. One more breath here. Inhale. Exhale. And then let's lift the knees. Inhale. Now you are going to separate your feet wider than your hips. So if you have a yoga mat, I normally say just at the distance of your yoga mat here. And then from here, we're going to do now, we work on open the hips. Now we're going to do abduction, that is like closing, adduction, sorry. That is like closing, create internal rotation of your hips. So you inhale, open. Inhale, open. Exhale, bring the knees together. 3 more. Inhale. Exhale. Inhale. Exhale. Last one. Open, inhale. When you exhale, keep your knees together and just allow your legs to rest towards one another. And again, we're going to bring the awareness to the breath. And notice how you feel in the lower back, the sacral. 3 deep breaths here. Inhalation. Slow exhale. Inhale. Exhale. One more breath here. Exhale. Good. And then you're going to keep your feet the way it is right now and just open the knees, okay? So the feet is still wide. Now from here, when you exhale, we're going to move both sides. So let's go to the right side. Go slowly. And then lift the legs. Inhale. Exhale. Let's go to the other side. Center. Inhale. Exhale. Center. Inhale. Exhale. Inhale. Exhale, and then let's stop here and stay. A few breaths here. Inhale, lift the knees. Exhale, let's do the other side. And pause. Let's come back to center. Inhale, and then bring the feet hip distance. Good. And release. So now, bring the right knee towards your chest and hold here. So it's important here that you are not pushing too much. Pushing, no, pulling, sorry. If you're not pulling too strong here, just hold the leg, and while we are here, just use this moment to create some circle on your ankles. Both sides. And then keep holding your leg here. You don't have to keep your leg very close to your chest. You can let your knee be more aligned with the hips, but keep holding the side of your leg. And then as you exhale, extend the leg. Inhale, return. Exhale. 2, 3, 4. You don't have to force the extension of your leg. If your leg just go like this, that's fine. You just work here, okay? And then let's do 2 more. Good, and then let's stay here. And you can use your hand to keep holding the leg here, or even if you have like a belt or anything, you can use the belt to help support the leg, okay? You can pass the belt around the foot. And then from here, you're gonna flex and extend your ankle. 2, 3, 4, and 5. Good. So now we're gonna try to create a little bit of external rotation. That's when my femur here rotate out and back, out and return. One more. And then keep the external rotation. You're gonna bend the knee and bring the ankle to the opposite leg. So before we do anything here, let's just stay here, okay? Notice how you feel. And then bring the right hand just close to your butt here. We're gonna create a little bit more of external rotation, pressing the leg on my hand and release. Press and release. And then I want you to notice if you are doing this movement, moving the pelvis. I'm exaggerating here, but we don't want this to happen. We just want to move the leg on the pelvis. So the pelvis stays stable and my leg, I'm pressing and release. You can do a few times. Good. And then from here, you stay here. You can open your arms, inhale. And then when you exhale, move the leg side to side. So you don't touch the floor yet. Just move slowly side to side. Notice how you feel on the lower back and the sacrum. And then now we're gonna move all the way so our foot, right foot, will touch the floor. Go slowly. And the idea here is that I keep my knee pointing towards the ceiling, okay? If that is okay, if it is too much of pain or tension, you can relax a little bit. But the idea, we keep the knee pointing up. 3. Shoulders relax. 2. 1. And then lift the legs, inhale. When you exhale, let's go to the other side. And stop here. And then take a few breaths here. 3, 2, and 1. Lift the leg, inhale, and then let's uncross. Actually, I'm gonna give you an option. You can, I'm not gonna stay long for the sake, I don't want this video to be too long, but from here, you stay here, you can bring the left knee towards your chest. So this will help to stretch more your hip and your glute on the right side. And then it's important when you're doing this pose that you are not rounding the spine like this, okay? So if you have to hold the leg here, you need to do this. I would recommend that you keep just here with the foot on the floor. And then let's do the other side. Let's bring the left knee, hold here, circle the ankle. The other side. And then let's extend and bend the knee. 1, 2, 3, 4, 5. And then stay here. Point and flex the toes. 1, 2, 3, 4, and 5. Let's create the external rotation. So I'm rotating the leg out and in. 1, 2, and 3. And then keep the external rotation, bend the knee, place the ankle on the opposite leg. So the same exercise, you're gonna bring the hand behind your leg here and then press the leg on my hand. 1, small movement, 2, 3, 4, and 5. Good, let's open the arms, inhale, exhale, start to just go side to side. And then let's move to the right side. The left foot will touch the floor. Stay here if you want, look to the opposite direction. So it helps the shoulders stay more ground on the floor. Take a few breaths here. And then let's lift, inhale. When you exhale, let's go to the other side. And then inhale, center. Again, if you did on the right side, you're gonna do this side as well. You're gonna bring the knee and stay here for a few breaths. Good. And then let's uncross the legs, bring both knees towards your chest, move side to side. And then place your feet on the floor and just notice how you feel. How is your body feeling right now? And to close our practice, let's take 3 deep breaths here. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Very good. Thank you so much. Make sure you stretch and move slowly to find a sitting position. So I always recommend when you lie down doing exercise, bend the knees, roll to one side, and then use your hands to help lift yourself to a sitting position. And that's it. Thank you very much. Namaste.